Good morning, everyone. My name is Annie Scully. I'm a research analyst at United Way of Connecticut 211, and I want to thank you for joining me today to discuss our 2018 Connecticut United Way's ALICE Report. This is the second webinar of our 2018 fall webinar series, so thank you so much for logging in. If you missed the first webinar, which was last week, all webinars will be recorded and made available on our 211ct.org training and outreach page. Our next webinar in the series will be next Wednesday, November 14th from 10 to 10:30, and that will focus on our 211ct.org Navigator, which is an online benefit screener. So don't forget to log in. If you haven't registered yet, you can do so by going to 211ct.org and clicking on the fall webinar banner at the top of the screen. Before we get started today, I want to go over a few housekeeping items. Everyone that's logged into the webinar is in listen-only mode, meaning that you won't have the opportunity to speak throughout the presentation. That being said, please feel free to direct your questions to the Q&A box, which you can access through your control panel at the bottom of your screen. That will allow me to field questions at the end of the webinar. If time allows, I'll answer each question individually, or I'll follow up via email to make sure that I address your questions in an adequate fashion. This webinar, as will all webinars, is being recorded and will be made available on our training outreach page after the presentation. I will also be emailing a set of our slides to each individual that registered for today's webinar. So thank you again, and let's get started. For struggling households in Connecticut, low wages, tight budgets, and limited savings often mean making tough financial choices. Working parents choose between quality childcare and healthy food for their children. Young adults juggling multiple jobs with inconsistent schedules choose between expensive rent and a long commute to work. And our aging adults approaching retirement by whether to ignore a car repair or forego a needed trip to the doctor. 6 years ago, Connecticut United Way is committed to shining a light on households that, despite working hard, live paycheck to paycheck and are unable to afford life's most basic necessities, such as housing, food, childcare, transportation, and healthcare. Connecticut United Ways, along with United Ways in 17 other states, call this demographic ALICE, which is an acronym that stands for Asset Limited, Income Constrained, Employed. Since the release of our first ALICE report, we have learned that ALICE lives in every town and city in Connecticut and is essential to the vitality of our communities. ALICE cares for our children and our aging parents, fixes our cars, and works in our local grocery stores, retail stores, and restaurants. ALICE is our friend, neighbor, coworker, and family member. We lean on ALICE for support, yet many households are one emergency away from a financial crisis impacting their ability to feed their family, heat their home, maintain their housing, and ensure their medical care. So we all know ALICE, and the 2018 ALICE report revealed that in Connecticut, 30% of all households qualify as ALICE. When combined with the 10% of households that are living below the federal poverty level, 40% of households are struggling. In 138 of Connecticut's 169 towns and cities, at least 1 in 5 households are ALICE households. We all know ALICE. As said, ALICE lives in every town and city in Connecticut. And in every town and city, at least 1 in 10 households are considered ALICE. As you can see from the map, from 2010 to 2016, the percentage of struggling households in Connecticut has increased. In fact, since 2010, the percentage of ALICE households has increased by 10%. If you look at the breakdown by household, as headed by age, the under 25 population is the only demographic or age group that saw a decrease since 2010 as far as the percentage of households that are struggling. That said, 75% of those households are still considered ALICE and struggle to make ends meet. These households, considered millennials, we know often are forced to live with their parents or cohabitate with multiple roommates, having been saddled by college debt that allows them to doesn't allow them to create their independent lives at this point. If we look at the next age group of the 25 to 44 households, 41% of those households are struggling to make ends meet and considered ALICE. This is an increase of 9% since 2010. For households that are in their prime earning years between 45 and 64 years old, we saw an increase of 21% since 2010, and 35% of those households are currently struggling to make ends meet. Finally, our over 65 population saw an increase of 12% in the percentage of households in our state, and an increase by 3% as far as the number that are struggling to get by. So what does it cost in Connecticut, and why are so many people struggling? The ALICE project creates a tool that allows us to study the true scope of financial hardship. This is called our ALICE Household Survival Budget, and it's a bare bone minimum cost of living budget that defines housing, childcare, food, transportation, healthcare, and technology as the basic needs that are required of a single adult or a family to get by. For a single adult, an hourly wage of nearly $13 is required to afford an annual household survival budget of nearly $25,000. A family of four, which is considered 2 adults, 1 infant, and 1 preschool, requires nearly $39 per hour to meet their bare minimum needs. And that's an annual total of nearly $78,000 in Connecticut. If we look through each line item in this budget, you may notice that some of these numbers seem a little bit low, and that's because this is a bare bones budget. And despite this being the minimum cost of living as defined by the ALICE project, 30% of households are considered ALICE, and an additional 10% are living in literal poverty in our state. For a little more detail about the methodology and sources used to create that household survival budget, this is a list of sources. For housing, we use HUD's fair market rental at 40%. Childcare is a registered family childcare home. Our food budget is the bare bones thrifty level, which is the lowest of the 4 levels defined by the U.S. Department of Agriculture. Transportation includes the expenses of a car and motor oil, but only one. So if you have a family of 4, you're sharing a car with your significant other or your spouse. Healthcare does not even include the cost of healthcare. It only includes nominal out-of-pocket costs and the penalty for not having healthcare. So once again, this household survival budget is a minimum bare bones cost of living. $12.34 for a single adult and $38.92 for a family of 4 if working full-time is what's required for ALICE families to meet their basic needs. But how much are people actually making in Connecticut? Despite having one of the highest wages in the country, there are still 45% of jobs that make less than $20 per hour. That's an increase from 2010, where 54% made less than $20 per hour, but it's still not enough for most families. We know that of those 45% of jobs that pay less than $20 per hour, 2/3 are paying less than $15. Despite having 55% of jobs that pay more than $20 an hour, if we look at the number of jobs in terms of the jobs that employ the most people in our state, only one of the top 20 jobs in terms of number of jobs pays enough to support the ALICE household survival budget for a family of 4. If you look at the chart, we see that retail salespersons, which employed more than 50,000 people in 2016, had a median hourly wage of $11.58, which is not even enough to support a single adult. Cashiers, which employed more than 38,000 people in 2016, had a median hourly wage of $10.68. Registered nurses, which is our 4th job, had a median hourly wage of $37.33. Many of these jobs, despite being the highest employers, do not provide enough money for families to get by. So what are some of the trends that were identified in our 2018 ALICE report that impact ALICE households? The first is the increase in on-demand or project-to-project jobs that's given rise to what we call the gig economy. This gig economy has limited job security, few or no benefits, and fluctuating and unreliable hours. These jobs, think Uber drivers, think TaskRabbit, think on-demand employment where people are only getting paid for what they're actually being employed to do. The next is the shift to a contingent workforce, which puts more financial risk on workers. These jobs also have unexpected gains and losses in work hours and income volatility, which makes it very difficult to plan for rent payments or a mortgage, or to keep up with your typical monthly expenses, because your income is up and down and you can't rely on a steady income. Finally, we have asset limited as being a defining characteristic of ALICE. More than 46% of Connecticut households do not have enough money saved to cover expenses for 3 months, making them extremely financially vulnerable to shock. Another statistic is that 40% of Americans cannot afford a $400 emergency. So what this means is that an unexpected car repair, an unexpected trip to the emergency room, an appliance that breaks in your kitchen or your laundry room can really send you spiraling into poverty, because there's no savings in that household survival budget that allows for families to provide for that cushion. What's also not included in that household survival budget is savings for retirement or for college. That household survival budget is really just a bare bones, week to week, month to month budget that allows families to get by. Finally, advances in technology will replace some existing jobs as well as create new employment opportunities for ALICE. Almost 2/3 of jobs, which is about 61% of jobs in the top 20 fastest growing occupations, could be replaced by technology in the next 2 decades. So these are some of the new trends that our 2018 ALICE report detailed. With the release of our second ALICE report, we launched what's called our Making Tough Choices ALICE Online Simulator. This allows individuals like you and me to walk in ALICE's shoes and really take a shot at seeing what it feels like to make the tough choices that ALICE families make every day. So we're quickly gonna jump out of our presentation and see if we can walk through ALICE's shoes. You can access the ALICE Online Simulator by going to www.makingtoughchoices.org or by visiting alice.ctunitedway.org and clicking on the icon. Not that icon. So this ALICE Online Simulator allows you to put yourself in the shoes of a typical ALICE household. It presents you with a situation that's far too common for many families in Connecticut and challenges you to walk in their shoes. So right now we're going to take the challenge. You and your partner have 2 small children, 1 infant and 1 preschooler. After an unexpected layoff at your place of employment, you find yourself scrambling to find a new job. Your partner's monthly earnings are $2,000, but there's some good news. You have 3 real job opportunities. The interviews went well, so you could have good reason to be optimistic. Let's start. The first choice is your job. Where are you going to work to provide for your family? Are you going to be a retail salesperson making $12 an hour, working part-time from 8 a.m. to 2 p.m., 4 days a week? You're going to be wait staff at a local restaurant, earning $10.60 per hour, working full-time 3 evenings from 11 p.m. to 3 p.m. to 11 p.m., 5 days a week? Or a grocery stockroom manager, making $21.30 per hour, 3rd shift from 11 p.m. to 7 a.m. Thinking about my lifestyle, I have 2 small children. Working a 3rd shift might be difficult for me. I'm going to choose to work my 3 p.m. to 11 p.m. shift at a local restaurant. Once you make your choice, the ALICE Online Simulator presents you with some data to provide you additional information about the choice you made. As we know, 45% of jobs in Connecticut pay less than that $20 per hour, with 2/3 paying less than $15 per hour. If we want to learn more, we can also read a little bit more about what it's like to struggle financially in Connecticut. So we know that ALICE workers hold many important jobs in our community, like retail sales, wait staff, home health aides, office clerks, receptionists, and so on. And that 45% of those jobs pay less than $40,000 a year. But it costs nearly $78,000 a year for a family of 4 to afford the essentials in our state. Let's continue. Our next choice is where we're going to live. Are we going to choose a single family homeowner with a small house with 3 bedrooms for $1,600, an apartment with 2 bedrooms in a large unit, or a 2-bedroom unit in an old house? With 2 small children, I think this small house with 3 bedrooms is our best bet. So ALICE households are often forced to spend more than 35% of their income on rent, mortgage, and utility costs. That's considered housing burden in Connecticut. Anything over 30% means that a family is housing burden and has less money to spend on other essentials like food and childcare. We know that the ALICE household survival budget for a family of 4 allocates 45% of our monthly expenses to childcare and housing. If we learn more, we know that 50% of renters and 32% of homeowners in Connecticut are considered housing burden, meaning they spend more than that, 1/3 or 30% of their income on housing. The next choice we're going to make is childcare for our 2 small children. Are we going to choose a licensed home-based childcare, family, friends, or neighbors to care for our children, or an accredited center-based childcare? If we look at our balance at the top of the screen, we see that our choices are already limited. We can't afford the licensed home-based childcare or the accredited center-based. So we're forced to spend to choose our family and friends and neighbors to care for our children. Childcare accounts for nearly 26% of the household survival budget and is often the single largest expense for households. While there are some subsidies for working families, many ALICE households exceed the income eligibility. And that's a real obstacle for many ALICE families. Because they have earnings that are above the federal poverty level, but below a basic cost of living, they're often in that in-between category that doesn't allow them to take advantage of awesome programs like Care for Kids, which provides childcare subsidies, or SNAP, which provides food stamps or subsidies to help afford food for our families. If we learn more, we know that those ALICE families that do not receive assistance are often faced with difficult choices around career advancements, and sometimes are forced to pass up on opportunities to earn more because they want to avoid what's called the benefit cliff. Earning more might mean that they all of a sudden lose their eligibility. Now we're going to choose our transportation. Our first choice is a car. You and your partner have one car that is paid for, and you have to pay for insurance and gas each month. And our second choice is to choose public transportation, which is a bus. Once again, if we look at our balance, we see that we are only able to afford a bus pass for you and your partner, which is $137. In Connecticut, there's limited public transportation, making it essential for most households to have a car. Without one, it's difficult to get to work, to shop for food, or to transport kids to childcare, school, or other activities. And finally, our last choice is food. We can choose a mix of fresh foods, or the freshest foods, a mix or a combination of fresh and frozen options, or our lowest cost, which is limited amounts of healthy options. And right here we see that with only $297 left, we can't afford any of these options to feed our family. So just like that, our challenge is over and we run out of money. I encourage everyone to take a moment to go through the online simulator on their own. There's ways that you can navigate through those initial choices and to be launched into what we call our interactions, where you kind of walk day to day in Alice's shoes. And now I'm going to jump back to our ALICE website to give you a little bit of a tour of what's available on the ALICE CT United Way, alice.ctunitedway.org website. So alice.ctunitedway.org is our homepage for all data and information regarding ALICE. If you go to this website, you'll see very quickly that you can click right here to download the full ALICE report, which will give you a much deeper dive into the findings of the 2018 report, as well as additional data that wasn't covered in this webinar. There's also links to additional reports that have been produced over the years, such as our ALICE Consequences of Insufficient Income report. You can link to our Making Tough Choices simulator, and also learn about some awesome programs that are being launched statewide. If you scroll to the bottom of the screen, you'll see there's some additional tabs that will link you to more information about ALICE, including our ALICE Toolkit that details how you can help ALICE, our ALICE Policy Agenda, which will be updated at the start of our 2019 session. For the past 3 years, Connecticut United Ways have structured their policy agenda around ways to help ALICE. All the way at the bottom, you'll see that there's an ALICE Update research brief that digs a little bit deeper into access for good jobs and how to save for the future, and talks about some of the struggles and opportunities that ALICE families have. All the way at the top of the screen, you'll see there's some additional tabs here. you can choose to meet Alice, which will bring you to a nice overview of our ALICE data statewide, detail some of the new trends in the 2018 report, and then provide you with a map where you can click on your individual town or city to learn a little bit more about some of the data and get a quick snapshot of how your town compares to the statewide average. So we see here by clicking on East Haddam that there's 3,541 households, that 6% live in poverty, 22% are ALICE, and combined, 28% are below that ALICE threshold. The Connecticut state average is that 10% are living in poverty and 30% are considered ALICE. If we continue to scroll down, we can also see municipalities with 40% or more of households below the ALICE threshold, and that's ordered by highest to lowest. So Hartford at 42% is followed by, or for a combined, it's combined. So as we scroll down, we'll see the number of ALICE households, or percentage of ALICE households, and the percentage of poverty. And then all the way at the bottom, there's some additional videos and information about ALICE, including our Connecticut United Ways United for ALICE video and an American Winter clip that shows once again what it's like to be a struggling family living paycheck to paycheck. If we go back to the top of the screen, you'll see that you can also meet ALICE by catchment area. So in Connecticut, United Way of Connecticut serves as a state association for our 15 local United Ways. So if you're interested in data just in your catchment area or your service area, you can choose an individual United Way to learn more. So if I click on United Way of Greater Waterbury, that will provide me with some additional details about ALICE in United Way of Greater Waterbury service area. Once again, there'll be a map where you can click on individual towns, a chart detailing ALICE and poverty, and then some additional links or information at the bottom of the screen. If you click on the 2018 ALICE Report tab, it will bring you to some additional ALICE data. Once again, you can find data by service area, as we just showed you, by clicking on any one of these links. You can also choose to look at ALICE data by county. So if you're interested in county level data, you can click here to link to an individual county to learn more about ALICE and have a quick flyer that you can print out and have handy. It'll give you a point in time at the top, provide some charts and graphs to show trends across time, and provide you with the household survival budget for that individual county. Earlier in the presentation, we went through the statewide ALICE household survival budget, but you can also access information at a county level. All the way to the right, it will also show you town by town the percentage of ALICE and poverty households within that county. And then finally, at the very bottom, you'll see additional ALICE household survival and stability budgets by county. And this is a question that we get all the time from data analysts or from those that are concerned citizens in their community, where they want to know more about the ALICE household survival budget and various household survival budgets. So not just for our single adult and our family of 4, but also for a married couple or for a single parent or for a single parent with 2 children or 3 children. And this ALICE household survival budget provides additional breakdowns of that information. So once again, you can click on that tab to get more information. The ALICE household stability budget is the goal for ALICE. So it's where we'd like ALICE to be able to move to achieve more financial stability. It provides for savings, which allows ALICE to plan for the future and avoid those financial shock or situations where they might go spiraling into poverty, and also provides additional funding for maybe a higher food budget or more money for transportation. So there's also information about the ALICE household stability budget. So with the release of our 3rd ALICE report, Connecticut United Ways continue to call attention to ALICE households by identifying barriers preventing ALICE from making ends meet. Connecticut United Ways continue to work towards short and long-term solutions that help ALICE families achieve financial stability. We invest in programs and services. So Connecticut United Ways invests in housing and homelessness prevention, childcare and early learning, job training and workforce development, and basic needs services so that families can succeed. Last year, Connecticut United Ways invested more than $40 million in programs serving those in need. We also promote financial security. United Way's support free tax preparation at VITA sites where eligible families can secure valuable tax credits such as the Earned Income Tax Credit and the Child Tax Credit. United Ways also support financial education and budget coaching opportunities, as well as digital savings incentive programs. In January of 2019, Connecticut United Ways Network will be launching an ALICE Saves initiative, which will help connect ALICE savers to online digital financial coaching, as well as a savings incentive and matching program that will encourage ALICE families to save money and secure funding. We also mobilize community partners. United Way is engaged with businesses, government agencies, and other nonprofit and faith-based communities, civic leaders, and anyone who wants to work towards individual and community-wide solutions that lead to more financial security for ALICE. And we connect residents to services. United Way 211 is Connecticut's 24/7 access to a range of health and human services. And last year, we fielded more than 323 requests for service from Connecticut residents. Housing, shelter, and mental health services, and employment and income were 211 CP's top 3 requests. So how will you help ALICE, and where will you stand with ALICE? If you're interested in helping ALICE, if you want to give, advocate, or volunteer to work with ALICE families, you can connect with your local United Way by clicking on About Connecticut United Ways tab at the top of the screen. You'll see here there's a list of Connecticut United Ways where you can go ahead and you can click and link to your local United Way. So with that, I want to say thank you so much for logging in today. If you have any questions at this time, please feel free to type them into the Q&A box. And if not, I'll be sure to follow up with a copy of the slideshow as well as the webinar recording.